As the saying goes, the first rule of the club is you do not talk about the club. But in this case, we are going to break that rule because it concerns your health, and there is no reason for something so dangerous to be hidden. So today, we are going to discuss 7 silent killers that are ruining your health and what you can do to fix them right now. And when I say silent killers, I mean literally silent. You may not even be aware of it, but it is wreaking havoc on your life. By the end of this video, you will know exactly where to look and what to do. Let's get started. Silent killer number 1, gum disease. Gum disease is one of the most common health problems affecting millions of people around the world. It is a bacterial infection of the soft tissues that support and surround the teeth. If left untreated, it can lead to tooth loss and a whole host of other health issues. The problem with gum disease is that it is often asymptomatic or silent, meaning that you may not be aware that you have it until it has progressed to a more advanced stage. This is why it is important to visit your dentist regularly for checkups and professional cleanings. During a dental checkup, your dentist will examine your mouth and look for signs of gum disease, such as red, swollen gums, bleeding gums, or loose teeth. They will also take X-rays to look at the bones that support your teeth. If gum disease is detected, your dentist will recommend a deep cleaning called scaling and root planing. This procedure removes plaque and tartar buildup below the gum line and smooths the tooth roots so that the gums can heal and reattach to the teeth. Silent killer number 2, sleep apnea. Sleep apnea is a potentially life-threatening condition in which a person, as breathing, repeatedly stops and starts during sleep. It is estimated that over 22 million Americans have sleep apnea, and the majority of cases go undiagnosed. Obstructive sleep apnea is the most common form of the disorder and occurs when the muscles in the back of the throat relax and block the airway. This can cause a person to stop breathing for several seconds to minutes at a time. A person may have hundreds of these episodes every night. Some people may still feel tired during the day despite sleeping for many hours. Loud snoring and an increased need to urinate at night are some of the warning signs of sleep apnea. If left untreated, sleep apnea can lead to serious health complications such as high blood pressure, heart disease, and stroke. Fortunately, there are effective treatments available for sleep apnea, including continuous positive airway pressure machines, oral appliances, and surgeries. Early diagnosis and treatment can significantly improve a person's quality of life and reduce their risk of developing serious health problems. Silent killer number 3, high blood sugar. High blood sugar or hyperglycemia occurs when there is too much sugar or glucose in the bloodstream. When you eat, your body breaks down the carbohydrates in your food into glucose, which is then absorbed into the bloodstream. Insulin, a hormone produced by the pancreas, helps glucose enter your cells to be used for energy. However, if you have diabetes or another condition that affects your body's ability to regulate blood sugar levels, glucose can build up in your bloodstream instead of being used by your cells. Over time, this can damage your organs and increase your risk of developing other health problems such as heart disease, stroke, and kidney disease. Many people with prediabetes or type 2 diabetes don't experience any noticeable symptoms, making it a silent killer. Regular checkups with your healthcare provider are essential to monitor your blood sugar levels and prevent complications from developing. They can perform a simple test using a glucometer to measure your blood sugar levels. If you're at risk for high blood sugar, you should see your doctor at least once a year for a hemoglobin A1C test. This test measures your average blood sugar levels over the past 2 to 3 months and can help identify any trends or patterns in your blood sugar control. If your blood sugar levels are consistently above 180 milligrams DL or 10 mol/L after fasting, you may have diabetes. Silent killer number 4, high cholesterol. High cholesterol is a major risk factor for heart disease and stroke. In fact, high LDL, or bad cholesterol, is the primary cause of atherosclerosis, a condition in which the arteries become narrowed and hardened. This can lead to chest pain, shortness of breath, and even heart attacks. Unfortunately, high cholesterol often has no warning signs or symptoms, making it difficult to detect. That's why it's important to get regular blood tests to check your cholesterol levels, especially if you have risk factors, such as a family history of heart disease or diabetes. The good news is that high cholesterol can be treated with lifestyle changes, such as eating a healthy diet, exercising regularly, and avoiding tobacco. In some cases, medication may also be necessary to help lower cholesterol levels and reduce the risk of heart disease. Remember, high cholesterol is a silent killer, but with regular checkups and the right lifestyle changes, you can keep your heart healthy. Silent killer number 5, high blood pressure. High blood pressure, also known as hypertension, is a common condition that affects millions of people worldwide. It is a major risk factor for heart disease, stroke, and kidney disease. The problem with high blood pressure is that it often does not produce any noticeable symptoms, which is why it is referred to as the silent killer. This means that many people who have high blood pressure do not know they are at risk for other health problems. Over time, high blood pressure can cause damage to the arteries, heart, and other organs. This can lead to serious complications such as heart failure, stroke, and kidney failure. It is important to monitor your blood pressure regularly, especially if you have risk factors such as diabetes, obesity, or a family history of hypertension. If you do have high blood pressure, there are several things you can do to help control it. These include eating a healthy diet, getting regular exercise, reducing stress, and avoiding tobacco. In some cases, medication may also be necessary to manage your blood pressure and prevent complications. By taking steps to control your blood pressure, you can help protect your overall health and reduce your risk of developing serious health problems. Silent killer number 6, vitamin D deficiency. Vitamin D is an essential nutrient that plays a role in maintaining strong bones and a healthy immune system. Our bodies produce vitamin D when our skin is exposed to sunlight. However, many people do not get enough vitamin D from sunlight or their diets. A vitamin D deficiency can lead to a number of health problems, including bone loss, muscle weakness, and impaired immune function. Additionally, studies have shown that a lack of vitamin D may contribute to the development of certain chronic conditions, such as diabetes, cancer, and heart disease. The problem with vitamin D deficiency is that it is often asymptomatic, meaning that you may not be aware that you are deficient. This is why it is important to get your vitamin D levels checked, especially if you live in a northern climate or have limited sun exposure. Fortunately, there are simple and effective ways to increase your vitamin D intake, such as taking supplements or consuming foods that are rich in vitamin D, such as fatty fish and fortified dairy products. By ensuring that you get enough vitamin D, you can help maintain your overall health and reduce your risk of developing a number of chronic conditions. Silent killer number 7, excess body fat. Excess body fat, especially when it comes to belly fat, can be a major health hazard. It is associated with a number of chronic diseases such as heart disease, stroke, type 2 diabetes, and certain types of cancer. The problem with excess body fat is that it releases inflammatory substances that can damage organs and tissues, leading to insulin resistance and chronic inflammation. This can increase your risk of developing serious health problems without you even realizing it. Fortunately, there are simple steps you can take to reduce your body fat percentage, such as eating a balanced diet, engaging in regular physical activity, and getting enough sleep. By making these changes, you can improve your overall health and reduce your risk of developing chronic diseases. So if you're concerned about your body fat percentage, don't hesitate to speak with your healthcare provider. They can help you develop a plan to achieve a healthy body fat percentage and reduce your risk of developing chronic diseases. Remember, It's never too late to make positive changes to improve your health and well-being. Don't forget to fix these silent killers right now. By following the tips mentioned in this video, you can effectively address the 7 silent killers that could be negatively impacting your health. Taking proactive steps to tackle these issues will not only improve your overall well-being, but also help you live a longer, happier, and more fulfilling life. Remember, knowledge is power, and by understanding the risks and taking action, you can truly be the hero of your own health story. Thanks for watching. See you next time.